Christy. How are you?
Good, Carrie. How are you?
I'm fine, thanks. We want to go over extravasation today now that you completed your course. And before you start administering chemo, I just want to make sure you're aware of all the terminology. Can you tell me what an extravasation is?
It's the leaking of a vesicant drug around the IV site into the tissue, and it can cause pain, necrosis, swelling, sloughing off of the skin, and various degrees of tissue damage.
Right. Now you mentioned a vesicant. What is a vesicant?
It is an agent that has the potential to cause blistering or tissue necrosis if it leaks into the tissue surrounding the IV site when giving chemotherapy.
Correct. And there are some anti-neoplastic agents that are considered irritants, and while these don't cause damage, they can inflame and irritate the vein during infusion. And you would need to know before you start administering your chemo agents whether they are classified as a vesicant or an irritant, so you would know how to manage those. The best way to avoid an extravasation, I feel, is by prevention and to make sure you're aware of all the risk factors. Can you tell me some of those?
Small veins, fragile veins, maybe multiple venipunctures in the same vein, sensory deficits like neuropathy, where the patient may not be able to feel what's going on at that IV site, maybe impaired cognition if they have been pre-medicated with something like Benadryl.
Right. Would it be unusual to ask on an elderly patient with poor, fragile veins to ask maybe for a PICC line insertion order if you felt that was the safest way to administer?
Right, you would ask the MD.
Okay. And as far as venipuncture sites, you would want to make sure you go above any prior venipuncture sites over that were over how long of a period of time beforehand?
About 24 hours beforehand.
And that would include lab draws and old IV sites. The other thing also that is a risk factor or something you need to make sure is that you have the IV secured, either with a stat lock or taped down, and that the patient's staying immobile in bed while you're administering the chemo. Can you give me some signs and symptoms that might lead you to believe you had an extravasation?
Right. The first would be pain. The patient would feel pain at the site. Swelling, redness, maybe loss of blood return, leaking around the IV site and or the port insertion site. And some of these symptoms might not show up for 6 to 12 hours after.
Right, which is important on a patient, especially in an outpatient area where they're discharged. You need to educate them so when they go home, they know to look out for those signs and symptoms. Is the presence of a blood return always indicate that there is no extravasation, that you can proceed?
No. If the patient's complaining of pain or irritation at the site, but you still get a blood return, you should rethink about using that IV site.
Correct. And also the presence of pain is not always a symptom. Sometimes you can have an extravasation with no pain, such as if they have neuropathies or they may be a little somnolent. They may not complain of pain, but you need to be assessing that site. The one other thing we'd like to have available on our unit, because this would be treated as an emergency if you suspected an extravasation, you would be calling a second nurse to come in to help you evaluate the situation, and to have an extravasation kit available that they can grab with everything at your fingertips is good to have. And we have listed, and you want to make sure you have everything not expired, so this should be checked frequently.
And what are some of the consequences of an extravasation of a vesicant?
Well, originally you might see some redness at the site, but you can also have some blistering, some peeling and sloughing of the skin, and tissue necrosis, which can be seen weeks later. Okay? Other consequences, which you also need to be aware of, though, are that the patient may have some disfigurement, loss of limb. There's the potential for financial burden and potential lawsuits, and also some sensory and functional impairment for the patient.
Okay.
Okay.
Hi, Mrs. Smith.
I'm just going to check your IV for a blood return to make sure that your chemo is infusing correctly. So all I'm going to do is just drop this down here, and then we're going to look to make sure that you have a blood return in your IV.
Okay.
Okay, Mr. Miller, your Big Christine is all done.
Oh, my IV's really hurting.
It's hurting?
Yeah, it's really hurting right there.
Okay, what I'm going to do is just cut this off, and we're going to see if we get a blood return from your IV.
Yeah, it didn't feel like that the whole time it was going in.
Let's see if we get a blood return. Okay, I don't see a blood return. I'm going to give your buzzer a buzz and see if we can get another nurse in here.
Yeah, it's really hurting.
Hi, Christy, did you need something?
Yeah, we're not going to have a blood return on Mr. Miller's IV. Could you get us the extravasation
I'll
kit?
be right back.
Who's going to bring in a kit of supplies that we can use for your IV?
All right, Christy, here's our extravasation kit. The charge nurse is calling the physician to notify him, and calling pharmacy for hyaluronidase. No, did you get a blood return?
I did not get a blood return, no.
All right, let me get some stuff together for you to help you out. Let me see what I need a gauze for you. And I'll get you a syringe to pull back on.
I'm just going to try again to see if we get a blood return.
Oh, it's still hurting.
Okay, I'm not getting a blood return. So we're going to take this IV out.
Oh, darn.
That's okay, it's what's best for you. Your doctor's being notified and we'll take care of this.
Is there medicine you can get to make it feel better?
There is, and it's on its way up from pharmacy.
Oh, you girls work fast.
Let me check if that's ready yet.
Doctor said he sent the orders and pharmacy mixed it.
And you received orders from the doctor?
Yes.
Okay, thank you.
Okay, Mr. Miller. What we're going to do is put some of this medication around your IV site.
Okay, can we just get a quick measurement and a marking on his arm of the area of infiltrate?
Okay. There you go.
And here is our hyaluronidase. It comes up in 1 ml. And we're going to give 5 sub-Q injections around that site. It's 0.2 mLs each injection. And we're going to make sure we change the needle with each injection. I'll help you out with that.
Thank you. And we're going to give 5 injections.
I'm sorry. And that's 4?
This is 4.
Okay, there's your 5th one.
Okay, all done.
Okay, let's put a sterile gauze over that site with the off site. All right, we're going to clean this up, sir, and then we want to have you keep your arm elevated.
Oh, I can do that.
We'll help you. We'll put a pillow underneath your arm.
Okay.
All right, there you go, sir. Now, we're going to be checking this site frequently, and the doctor's going to come up to see you as well, and we'll clean up our mess. You need to let us know if you have any further increase in pain in between our checking this site here.
Okay, I can do that.
And here I just got the warm compress for you as well. Are you comfortable?
Yes. That feels really good on my arm.
Okay, we'll be back in to check.
It's getting a little warm though.
Let me put a towel underneath that.
Okay, that might be a little more comfortable.
Okay, you let us know if it gets too warm, all right?
Oh, that feels better.
Okay.
Well, thanks, ladies.
All right, Mr. Miller, I'm just giving you your adriamycin. Are you feeling okay?
Yeah, I seem to be okay.
Okay, I just need you to let me know if you're feeling any discomfort at that IV site at all.
Alrighty.
It looks good.
Now that you mention it, it is a little itchy.
Oh, it's itchy. Right at the site there?
Yeah, right there where that needle goes in, it's just a little itchy.
Okay, I'm gonna unhook this here. You actually, sometimes when you give Adria, it's called an Adria flare, and you're not having any pain.
No, it doesn't hurt, just itchy.
I'm gonna call for a nurse to come in for a second opinion.
Alright.
And I have stopped giving this adriamycin for right now. Can I help you? Tish, can you just confirm? I think Mr. Miller's having a little Adria flare.
Sure, I'll be right in.
I'm going to open up the saline. Hey, Mr. Miller, what's going on?
Oh, my site's like itchy from giving that medicine.
Yeah. I think it's a flare, Carrie. We'll give you some saline. If it continues to itch, let us know. We'll notify the doctor. He might want to give you a steroid.
And the redness is going away with the saline there. Is it still itching you?
Seems to be getting a little bit better.
Okay, good.
All right, we're just going to let some saline run and see how you're doing. We're going to hold off on completing the Adria for about a half an hour just to make sure that your site's okay and the itching is resolved.
Okay.
If it hasn't, we can always give a call to the doctor. We can give you some IV steroid to help with that.
Okay, so my IV site is okay, I don't need a new one.
I'm going to check your blood return.
That looks good.
And it's good.
Oh, good.
Okay, well, call me back if you need anything.
Okay, thank you, Tish.
You're welcome.
Will you let me know when that you called the doctor?
Yes.
How's it feeling?
Feels good. It does not
Okay.
even itch anymore.
Okay. We're still going to wait about a half an hour and then we'll resume. Okay?
Alright, sounds good.
All right, Mr. Miller. How are you feeling?
Good.
Your IV site feeling okay?
Yep, feels just fine.
Okay, there's no redness or swelling or any problems. All right, I'm going to check a blood return. Okay, you sure there's no discomfort there at that site?
Nope, doesn't hurt.
Okay, unfortunately, we don't have a blood return, so like I told you, we're gonna have to stop, and I'm gonna call for a nurse in to
come help me out.
All right.
Can I help you? Tish, could you bring the extravasation kit, please,
Sure.
for Adria?
What are you talking about? My IV doesn't hurt.
I know it doesn't, Mr. Miller, but there is no blood return, so Tish is here to verify with me.
All right.
Mr. Miller, there's no swelling or pain, but I am not getting a blood return. No pain at all, Mr. Miller?
No, it doesn't hurt.
Okay. Looks a little puffy here. Okay. I think we better call Dr. Rossetti, maybe get an order for toe tap. Do you want me to put another needle in his other arm? I do. It needs to be in the opposite arm.
No, I don't want another IV. My veins are shot.
Mr. Miller, I'm very sorry, but it's in your best interest where we cannot give any chemo if there's no blood return, and it would be safest for you. Unfortunately,
I don't think you'd be able to get another one. My veins are just horrible.
well, Tish is an excellent IV nurse, and if we have trouble, we can always call the IV team.
Isn't that something I can refuse?
You can, but unfortunately, we still need to take this IV out and treat it with a medication called Totec. And it's to prevent any further tissue damage. While it may look fine now, the damage you might not notice for even a day or so. So we do need to treat this now.
Are you okay with me putting your needle in? I guess.
All right, Mr. Miller, I'm going to remove this IV. I'm going to pull back some medication. And Tish is on her way in to get that other IV started on you. Mr. Miller, I'm going to put the IV in your other arm, in your left arm, because you have to put it in the opposite arm that the medication was going through.
Oh, I hate IVs. My veins are so bad.
I know you do, but I'm pretty good at IVs. I should be able to get it in one stick, okay?
All right.
She's more than pretty good. She's very good. Thanks, Carrie. Okay, are you ready?
I'm ready.
All right. There's a nasty pinch. Okay.
You get it?
It's in.
Oh, thank goodness.
Okay.
Oh, that wasn't as bad as I thought.
Waiting for Dr. Rossetti to call back with the order for the toe tap. I've already notified pharmacy. They can get it ready with his correct dose. We would need 1,790. Yes,
Correct.
it's 1,000 milligrams per meter squared with a maximum of 2,000 milligrams to be given. And that needs to be given as soon as possible. And fortunately, our facility has that in storage. I'm going to mark this site while we're discussing that so we can record the measurement. It's given day 1, day 2, and day 3. So Mr. Miller, you're going to need this infusion.
Okay, I'll be back when the med gets through.
For 3 days in a row. It runs over 2 hours. And it needs to be given it's close to 24 hours apart for each dose. As soon as I'm finished with this dressing here, we're going to put a ice compress on your arm. 15 minutes before we start this Totec infusion I told you about, we're going to need to remove the ice. It needs to be off for 15 minutes before the infusion starts.
Oh, I see.
Hey,
What?
Carrie,
Yeah.
the medication's here now. Thank goodness we have it here on site at West Penn. If this was any other hospital, they would have to call and notify West Penn Pharmacy to get it.
Okay. Well, I'm still gowned with my chemo, so since this is a chemo agent, I'll do the administration if you could do the double check with me.
Okay. I have the orders Dr. Rossetti approved.
This is for Miller, M-I-L-L-E-R, Paul. Date of birth is 9/30/50. Is that you, sir?
That's me.
And his MR number is 1500898. 2672.
Okay. Okay, today is day 1, and we're treating with Totec, and it's ordered 1,000 milligrams per meter square, and his meter square is 1.79, so we're given a dose of 1,790 milligrams. And
Correct.
it's to infuse over 2 hours, and we're going to infuse that in the left arm.
Correct, opposite arm of the extravasation.
Need anything else?
I don't think so. We'll need my ice bag, not right now, but
Okay. I'll get that for you.
after this infusion is complete, we're going to be starting with the ice compresses.
Okay.
All right, Mr. Miller, I'm going to hook up this saline to run our Totec through.
All right.
And I need to put this pad under your arm again. And during this infusion, I'm going to make sure, since you just went to the bathroom, I'm going to ask that you don't get up again, okay?
Okay.
Until this infusion is done, or you call for help.
All right, I'll be sure to do that. Yeah, that's a pretty big bag. I'll probably have to go.
We'll have a urinal handy for you.
All right.
All right, and we checked our blood returns since this was just inserted. And Tish is on her way back in to double check my rate. We talked about treatment for various vesicants, but in the event that you are giving a vesicant and have an extravasation, there are several that do not have an antidote. And we do keep as a reference manual on our unit the ONS Chemo and Biotherapy Guideline Recommendations for Practice. This is what we base our policy off of, and if you're ever in question, you can refer to this manual. Some vesicants such as, or irritants such as taxane have no antidote. In this case with taxane, we would elevate the arm, apply ice compresses 4 times a day for 15 minutes for the first 24 hours, and of course always reassess the site and educate the patient as we normally would.